I'm Anthony Ghosh, a consultant spinal neurosurgeon and director of the Spine MDT. In my clinic, I often meet patients who have previously undergone spine surgery and have come to regret it. I want to be absolutely clear that the purpose of this video is not to scaremonger or discredit any other surgeon. I myself carry out a lot of spinal neurosurgery, and so do many surgeons I know and colleagues with good results. Often the regret is not because the surgery was done badly in any way, it's because the initial indication for the procedure was incorrect. Common regrets I hear are, I've had the surgery but I am still in pain, or the pain went away for a bit but now it's back, I didn't know how long recovery would take, or I've had the surgery and the pain is now worse. Let's look at why your back pain might still be present, or in some cases even worse. A common mistake made is assuming the findings on the MRI scan are the cause of your back pain. Take, for example, a dehydrated disc shown here, or even a disc bulge. A really interesting study looked at people without back pain of different ages who underwent MRI. And this study showed that most people above the age of 40 will have abnormal findings on their MRI scan despite not having any symptoms at all, and these include disc degeneration or signal loss, disc height loss, bulging discs, or even some problems with the joints of the spine, facet degeneration or spondylolisthesis, a forward slippage of one bone over the other. So we have to be absolutely sure that the findings in the MRI scan match the symptoms that you have. Now this is easier when you have nerve entrapment and therefore leg pain radiating down your leg, as shown on this MRI scan here. Yes, surgery to decompress the nerve will alleviate the leg pain, but we find in treating back pain itself, things are far more complex. If we think of back pain as a jigsaw puzzle, the findings on the scan, the anatomy and the pathology only make up small pieces of the puzzle. Any false beliefs we then develop about the diagnosis will cause us to have false guarding mechanisms, ways that we behave in a way that we think is going to avoid the pain but actually makes it worse. Also, we may be avoiding certain movements that might make it better, but in the long term we're actually making things worse. And then there are other things like stress and anxiety, which we know are potent amplifiers in chronic pain. Misdiagnosis, and therefore false beliefs that lead to worsening of back pain, is often made worse by MRI scans where the report isn't interpreted properly. This study showed that if we take two groups of patients with back pain, we show one group of patients the report, and the other group of patients, we explain the report to them and thoroughly correlate the findings of the scan with their symptoms, the latter group actually do better. Often healthcare systems that are under strain, be it public or insurance funded, can make us act a bit too fast. And therefore we're not exploring all of the possibilities, interpreting the scan and tying them in properly with the clinical findings of the patient, involving a whole team where the surgeon has some oversight, discusses the scans with the physiotherapy so that we have the appropriate strategies, and also identifying any behaviours you might have or beliefs you might have that might actually be making the pain worse because you're either avoiding certain movements or adopting certain false behavioural protective movements. So how can we avoid regret? Firstly, make sure your symptoms match the findings of your scan and get your surgeon to explain that to you. Have you explored other options with your surgeon, such as physiotherapy or osteopathic manipulations? Is your surgeon happy to speak directly with your physiotherapist, go over the scans together, and then figure out the appropriate strategy? Also, ask your surgeon, what happens if I do nothing for now? This often leads to opening up a more honest discussion. Usually the only hard indications for surgery are progressive neurological deficits. So for example, enough nerve compression that you're starting to lose power in either your arms or your legs. Enough counselling and education around your condition is absolutely vital in your ongoing recovery. Whilst the surgery may go very well, we want to prevent the symptoms recurring. So again, identifying any false beliefs you may have about your spine and therefore changing certain behaviours or lifestyle factors will help prevent the pain coming back. We also have to be absolutely clear about the recovery after surgery. So go through this very carefully, how long the pain from the surgery itself will last, when you can be expected to return to work or routine activity. So in conclusion, spine surgery can be a very powerful and life-improving tool. It works best when there is a structural cause identified on your scan that absolutely matches your signs and symptoms. Every patient is unique, so we have to be sure that we've considered all other options of treatment. This is done best when a surgeon can oversee a team of either physiotherapists, osteopaths, or other healthcare professionals who have understood you together and therefore be able to come up with a good management plan that might not involve surgery. And then if surgery is needed, we can be more sure that we'll get a better result. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. And please visit us at spinemdt.com to see how we can help you. Thank you for watching.